My name is Marilyn. I'm the clinician. I'll be working with you today. Today we're going to be doing your extraoral and intraoral exam. And what we're doing with that is we're looking to make sure everything is fine with you. We're observing how your face looks and making sure you don't have anything that we need to pay attention to. And then we'll look inside your mouth. And then when we're done, I'll explain everything that I have done. If you feel any pain at all while I'm doing it, let me know.
Okay.
Thank you. I'm going to put on my mask so I look like the mask bandit, and I'm going to get some gloves.
Okay.
Okay, first I'm going to start down here. This is called the occipital area, and I'm checking to see if I feel any nodules. And I'm coming back here behind your ears, and it's called the postauricular, and I'll come around in the front is your preauricular area. As I'm coming down, I will come up here now into the temporal area. Is everything feeling fine?
Yes.
Good. Good. I'm going to come down. This is your parotid glands. If you ever had the mumps, this is the area you get really large. Okay. The glands swell. I'm going to have you bite tight, and I'm checking the masseter muscle here. As I come down now and relax, I'm going to take my finger, come along the inferior border of the ramus. All of a sudden I feel this little nodule here, or a little indentation, and I'll take my fingers and I'm going to go under and feel for the submandibular gland and come up on the front here. Okay. I'm going to have you bring your head back a little bit, just a little bit there. Okay, what I want you to do is open, close, open, and now slide your jaw from side to side. And what I'm doing on this one is I'm feeling your temporomandibular joint to see if it's cracking or if you hear any popping sounds, and also if your bite is in good alignment there. Okay. Have you bring your chin down, and I want you to turn your head over to the left, and here I'm doing checking the
anterior cervical lymph node change.
Yeah, the anterior, but the sternocleidomastoid muscle here. And I'm just coming down with that to make sure there are no little nodules, any bumps or lumps. Now I want you to turn to the other side. Bring your chin down a little bit there. And once I brought her chin down, see how the sternocleidomastoid went out a little bit more? And I'm able to feel that, and I'm also able to feel the anterior chain here. I'm going to feel for the
Supraclavicular.
supraclavicular in this area, and now I'm going to turn this way, and again on this side. Okay. Our next stop is the thyroid gland, and I'm going to have the patient look straight ahead, and I'm going to be feeling both sides of the thyroid, and then I'm going to have her swallow. Swallow, please. This is when I always swallow with the patient out of sympathy.
Looking great.
Okay, we're going to now start with the intraoral exam. I've put on new gloves, and I have you with eyewear. I'm going to first look in your mouth to make sure that there are no areas that you might have a little sore in your mouth. Do you have any sores in your mouth? Okay, good. Okay, now I'm going to palpate your lips, looking for any lumps or bumps. Sometimes patients, if they've been hit in the mouth with a ball, will have like a little scarring tissue, or if you've ever had a cut on your lips. Let me go ahead and look in. I'm looking into the vestibule. I'm looking over here on this side of the cheek, and then I'm going to look over here. A lot of times patients will get little bite lines, we call that. I'm going to now look in your mouth. I do it very systematic. I kind of do a sweeping motion, making sure that everything is fine. Sometimes people have what we call a tori up here. It's a little bony growth, and I'm making sure that you don't have that going on. Sometimes people get burns right up in here from drinking coffee or eating pizza. Okay. I want to look down here. I'm going to go ahead and I'm going to have you open your mouth really wide, stick out your tongue, go ah. And while I'm doing this, I'm looking at the dorsal or the top portion of your tongue. I'm going to get a 2 by 2. And I'm folding it in half. Stick out your tongue for me, please. And I'm going to check. Getting way back here, making sure everything's okay with the tongue. Kind of pulling your tongue all around and allowing me to see what's going on. Also want to look into the mucosa here. Okay.
And I notice on the tongue that you're using a mirror to reflect light and also to be able to look back at the
Exactly.
lingual tonsil area and such.
And then when I'm here, I'm going to palpate